All right, let's dive into those renal lab values.
Mm.
Sometimes those numbers, they can be a little confusing, but they really do tell us so much about how those kidneys are doing.
Yeah.
So we've got some excerpts here from renal lab values and
Ah.
also renal UA.
Great.
Our mission today, should we choose to accept it, is to kind of decode these values so you can understand what they mean,
Right.
what they really mean for your health.
Yeah.
Think of it as like learning a secret language that unlocks the mysteries of your kidneys. Pretty cool, huh?
Absolutely. And it's knowledge that can make a real difference, in your life.
Oh, for sure. So let's jump right in. One of the sources immediately flags creatinine as like a critical kidney lab value.
Right.
It even says creatinine equals critical kidney lab in big, bold letters.
Yes.
So why all the fuss about creatinine?
Well, creatinine basically is a waste product. It comes from your muscles, just a natural part of living and moving. Your kidneys are responsible for filtering it out of your blood.
So we all have it.
Yeah.
And the kidney's job is to get rid of it.
Right.
But the source also says that if your creatinine levels are over 1.3,
Okay.
that's a red flag. So what does that actually mean for someone?
Okay.
Does that mean like they automatically need dialysis or?
No, not necessarily, but it's definitely a sign that something might be up with the kidneys, right?
Okay.
Elevated creatinine levels basically mean that the kidneys are not filtering as effectively as they should.
Okay.
It could be a sign of kidney disease, but other factors can also affect creatinine levels, like dehydration or certain medications.
So it's more of a clue to investigate further,
Yes,
not
yes.
necessarily a reason to panic, right?
Right.
What kind of lifestyle changes or treatments might someone need to consider if they have like high creatinine levels?
Well, it really depends on the underlying cause
Sure.
and the severity of the issue.
Okay.
If it's related to dehydration,
Right.
simply increasing fluid intake might be enough. But if it's a sign of kidney disease, then dietary changes, medication, or even dialysis might be necessary.
Wow. So creatinine's definitely a value worth paying attention to.
Yeah, absolutely.
The source also mentions something called HUC. They even use a funny mnemonic to remember it. The kidneys filter out HUC since the kidneys sort of look like a pirate hook.
Yeah. Yeah, I like that one.
I love a good mnemonic, right?
Yeah.
But what does HUC actually stand for and how does it relate to kidney function?
So that mnemonic is a great way to remember the 3 key things that your kidneys filter. H plus A,
Okay.
which is hydrogen ions, urea, BUN, and creatinine, hence HUC.
Okay, so we already talked about creatinine. Let's break down the other two, starting with hydrogen ions. You mentioned these are like acidic particles. If they're out of whack, how does that actually impact someone's, day-to-day life?
So if there's a buildup of hydrogen ions in your blood,
Right.
it becomes too acidic.
Okay.
It's a condition called acidosis.
Okay.
Acidosis can make you feel fatigued, nauseous, and even short of breath. It can also mess with your heart rhythm, and in severe cases can even lead to coma.
Wow, I had no idea that those tiny little hydrogen ions could have such a big impact.
Yeah.
So it sounds like the kidneys play like a vital role in keeping our blood pH balanced.
Absolutely.
And what about urea? What's that all about?
So urea, also known as BUN, is basically waste from protein breakdown.
Okay.
Your liver packages it up as urea, and then the kidneys toss it out in your urine.
So if my BUN is high, does that automatically mean my kidneys are in trouble? Or could it be something else, like I ate a giant steak the night before my blood test?
You bring up a good point.
Yeah.
Diet can definitely affect BUN levels.
Okay.
High protein intake can temporarily elevate your BUN,
Right.
but it should go back to normal once your body processes that protein. However, consistently high BUN, especially in conjunction with other abnormal values like high creatinine,
Sure.
can be a sign of kidney dysfunction.
Okay, so it's all about looking at the bigger picture and not just fixating on one value in isolation.
Exactly.
Fascinating. Now let's switch gears from blood tests to something we all relate to. P.
All right.
The source, renal UA, breaks down what a urinalysis can tell us about kidney health.
Right.
It's amazing how much information we can get from something we usually just flush away.
It really is. Urinalysis is a simple but incredibly valuable tool for assessing kidney function.
Okay, so let's walk through some of the key elements mentioned in the source.
Okay.
First up is color. I've always wondered, why does my pee sometimes look like pale lemonade and other times it's more like apple juice? Does that actually mean anything?
You're actually right on track.
Okay.
Urine color can be a good indicator of hydration.
Yeah.
Pale yellow or straw-colored urine generally means you're well hydrated.
Right.
As urine gets more concentrated,
Right.
the color gets darker. So if you're seeing like dark yellow or amber urine,
Yeah.
it's a good sign that you need to drink more water.
Okay, so that's easy enough to understand. Light is good, dark means grab a water bottle.
Right.
But the source also mentions specific gravity. What's that all about?
So specific gravity is a measure of how concentrated your urine is. Think of it this way.
Okay.
If your urine has a low specific gravity,
Yeah.
it's more dilute, like water.
Okay.
A high specific gravity means it's more concentrated, like syrup.
So it's basically another way of assessing hydration, right?
Exactly.
But how does that actually translate to, like, how my kidneys are functioning?
Well, your kidneys are responsible for regulating the concentration of your urine.
Gotcha.
If they're not working properly,
Right.
they might not be able to concentrate urine effectively, even if you're dehydrated.
Oh, okay.
So a low specific gravity, even when you haven't been drinking much fluid,
Right.
could be a sign that your kidneys aren't doing their job as well as they should.
Interesting. So even something as simple as specific gravity
Exactly.
can provide valuable clues about kidney function. Now, things get a little more serious when we start seeing things in our urine that shouldn't be there,
Right.
like red blood cells.
Right.
The source mentions that blood in the urine, or hematuria,
Yeah.
is never something to ignore. Why is that?
So blood in the urine can be a sign of several things, some more serious than others. It could be something as simple as a urinary tract infection,
Right.
or it could indicate something more serious like kidney stones, kidney disease,
Wow.
or even cancer.
That's a pretty wide range of possibilities.
It is.
So it's definitely a symptom that warrants further investigation.
Absolutely.
What about white blood cells in the urine? What does that tell us?
So white blood cells are your body's infection fighters.
Right.
So finding them in your urine is a strong indication of a urinary tract infection or UTI.
UTIs are definitely no fun.
No.
And I see the source highlights another clue for a specific type of UTI, nitrites. It even gives a handy mnemonic. N for nitrites,
Yeah.
N for pyelonephritis.
Yeah.
So nitrates in the urine mean I have a kidney infection.
So it's not quite that simple.
Okay.
Many bacteria that cause UTIs produce nitrites,
Okay.
but not all of them do. So while nitrites in your urine suggest a UTI,
Got it.
it doesn't necessarily mean that you have a kidney infection, which is what pyelonephritis is.
Okay, so
Huh?
it's another piece of the puzzle, but not a definitive diagnosis on its own.
Exactly.
Got it. This is all starting to make sense, but I have to admit it can be a little overwhelming trying to keep all these values straight.
I understand. It's a lot of information to process. But the more you learn about these values and how they relate to each other,
Yeah.
the easier it becomes to spot potential problems and understand their significance.
Well, I feel like we've already learned a ton. We've decoded creatinine, we
Right.
explored the mysteries of HUC,
Yeah.
and we've discovered how much a simple p-test can reveal about our health. But the source material also includes some specific scenarios
Right.
that really put this knowledge to the test.
Yes.
So are you ready to dive into those?
Absolutely. Let's see how these lab values play out in real-life situations. Welcome back to our deep dive into the fascinating world of kidney function.
All right, so let's pick up where we left off. We've already covered, some key individual lab values, but I'm kind of curious, is there like a single number that kind of gives like an overall picture of how well my kidneys are filtering my blood?
There is.
Okay.
It's called the glomerular filtration rate, or GFR.
But GFR.
GFR.
Yeah. I've heard that term before, but to be honest with you, I'm a little fuzzy on the details.
Okay.
What does like a good GFR look like?
Yeah.
And what happens when it starts to drop?
So a normal GFR is typically 90 or above.
Okay.
And as kidney function declines, your GFR goes down.
So let's say my GFR is 60. What does that actually mean for me? Like, how does that translate to my overall health?
So a GFR of 60 indicates stage 3 chronic kidney disease.
Okay.
So it means that your kidneys are only functioning at about 60% of their normal capacity.
Gotcha.
You might not notice any symptoms yet, but it's a sign that your kidneys are struggling and
Yeah.
need some extra attention.
So even if I feel fine, a low GFR is a sign that I need to take steps to protect my kidneys.
Exactly.
What kind of things can I do to slow down the progression of kidney disease
Yeah.
and maybe even improve my GFR?
There are several things you can do.
Okay.
Managing your blood pressure and blood sugar if you have diabetes is crucial.
Okay.
Those two conditions can really take a toll on your kidneys.
Right, we talked about that earlier. High blood sugar and high blood pressure, it's like little wrecking balls for those delicate blood vessels in the kidneys.
Exactly.
Anything else I should be doing?
Absolutely. A healthy diet, low in sodium and processed foods, is important.
Gotcha.
Staying hydrated is key, as is getting regular exercise.
Yeah.
And of course, avoiding things that are toxic to your kidneys, like smoking and
Right.
excessive alcohol consumption.
It sounds like a lot of the advice for keeping my kidneys healthy is the same advice I'd get for overall good health. Makes sense.
Yeah.
But what if, like, my GFR continues to decline despite my best efforts?
Mm-hmm.
What are my options then?
So in more advanced cases of kidney disease,
Yeah.
treatments like dialysis or even a kidney transplant might be necessary.
Dialysis and kidney transplants are obviously major medical interventions.
They are.
It really underscores how important it is to, like, catch kidney disease early and take steps to manage it proactively.
Exactly. Early detection and intervention are key to preserving kidney function and avoiding more invasive treatments down the road.
Right.
Speaking of early detection,
Yeah.
let's talk about a condition that's a major risk factor for kidney disease. Diabetes.
Okay, diabetes. I know it's all about high blood sugar,
Yeah.
but I'm not exactly clear on how it, like, damages the kidneys. Can you connect the dots for me?
Sure. So imagine those tiny filters in your kidneys, the glomeruli we talked about earlier.
Yeah.
Over time, high blood sugar can damage those delicate blood vessels,
Yeah.
making them thick and leaky.
So it's like high blood sugar is slowly gumming up the works of my kidneys.
That's a good way to put it.
Okay.
And when those filters are damaged, they can't do their job as effectively.
Right.
Waste products start to build up in the blood,
Oh, wow.
and important proteins leak out into the urine.
So that explains why protein in the urine is like a red flag for kidney damage in people with diabetes.
Exactly.
It's like those leaky filters are letting the good stuff slip through.
Exactly.
Are there any other, like, early signs of kidney trouble I should be looking out for if I have diabetes?
Absolutely. A gradual increase in creatinine is another early warning sign.
Okay.
Remember, creatinine is that waste product from your muscles. If your kidneys aren't filtering efficiently,
Yeah.
creatinine levels in your blood will start to creep up.
Okay, so I'm seeing a pattern here.
Yeah.
It's not just about, like, a single high value,
Right.
but a trend over time. If my creatinine is slowly but surely increasing, that's a sign that something's not quite right with my kidneys.
Exactly.
And I imagine it's similar for BUN, right? A steady upward trend isn't a good sign.
Exactly. It's all about paying attention to those subtle shifts in your lab values
Right.
and not just focusing on a single snapshot in time.
Gotcha.
And of course, working closely with your doctor to interpret those results and create a plan to protect your kidneys.
This is incredibly helpful. I'm feeling much more empowered to, like, have these conversations with my doctor and, like, advocate for my own kidney health.
Good.
Now, besides diabetes, we also mentioned hypertension or high blood pressure as a major threat to kidney health.
Right.
How does high blood pressure damage those hardworking kidneys?
So high blood pressure puts constant stress on those tiny blood vessels in your kidneys.
Okay.
It's like having a garden hose with too much pressure. Eventually, it starts to weaken and spring leaks.
So those delicate blood vessels get stretched and strained, and eventually they just can't keep up.
Exactly.
And I'm guessing, just like with diabetes, this damage often happens silently and gradually, right?
Often.
I might not even realize my kidneys are in trouble until it's too late.
That's one of the scariest things about both diabetes and high blood pressure.
Right.
They can wreak havoc on your kidneys without you even realizing it.
Wow.
That's why regular checkups with your doctor are so important.
Okay.
They can monitor your blood pressure, check for protein in your urine, and order blood tests to assess your kidney function.
So knowledge is power.
Absolutely.
The more I understand about these lab values, the better equipped I am to protect my kidneys and stay healthy.
You got it. And speaking of knowledge,
Yes.
we've got even more fascinating insights to share in the final part of our deep dive.
Ooh, exciting.
Stay tuned.
All right, so we are back for the final part of our deep dive into the world of kidney function. We've covered a lot of ground, from creatinine to UTIs to the impact of diabetes and high blood pressure. I feel like I'm practically a nephrologist now.
Well, you're certainly well on your way to becoming a kidney whiz.
There we go.
But we've still got some fascinating territory to explore.
Perfect, because my curiosity is definitely piqued.
Yeah.
What other kidney secrets are you ready to reveal?
Let's talk about a really powerful system in your body that you might not even realize is intimately connected to your kidneys.
Okay.
It's called the renin-angiotensin-aldosterone system.
The what?
or RAAS for short.
Okay, RAAS.
RAAS.
I've heard that term, but I'll be honest with you, it sounds a little intimidating.
It does. It's a mouthful,
Yeah.
but it's really fascinating.
Okay. So what is this system all about, and why should I care about it?
Think of the RAAS system as your body's blood pressure control system, with your kidneys playing a leading role.
Okay.
It's a complex cascade of hormones that work together to regulate blood pressure and fluid balance.
My kidneys are like the conductors of this hormonal orchestra.
That's a great analogy.
I like that.
So when your blood pressure drops,
Yeah.
your kidneys release an enzyme called renin.
Yeah.
Renin then sets off a chain reaction that ultimately leads to the production of angiotensin II,
Okay.
which is a powerful hormone that constricts your blood vessels, which raises your blood pressure.
So angiotensin II is like the emergency responder that kicks in when my blood pressure takes a dip.
Exactly.
What about aldosterone? Where does that fit into the picture?
So aldosterone is another key player in the RAS system.
Okay.
It's produced by the adrenal glands, which sit right on top of your kidneys.
Okay.
And aldosterone tells your kidneys to hold on to more sodium and water, which also increases blood volume and pressure.
It sounds like a tag team effort to keep my blood pressure from, like, bottoming out.
Exactly.
But what happens if this system gets, like, a little overzealous?
That's when things can kind of go sideways.
Uh-oh.
An overactive RAS system can contribute to high blood pressure, which we know can damage the kidneys over time.
So the bit of a double-edged sword.
Yeah.
It's there to help regulate my blood pressure,
Right?
but if it goes into overdrive, it can actually end up harming my kidneys.
Exactly. And that's why medications that block the RAS system are often prescribed to people with high blood pressure and kidney disease. These medications, like ACE inhibitors and ARBs, can help lower blood pressure and protect the kidneys from further damage.
It's incredible how much we can do to, like, fine-tune these complex systems in our body.
I know, it's amazing.
Speaking of advancements, what's new and exciting in the world of kidney care? You know, I've heard whispers about things like artificial kidneys, even growing new kidneys from stem cells. Is that science fiction, or is that the future of nephrology?
It's definitely not science fiction.
Okay.
There is some incredibly exciting research happening right now.
Wow.
Scientists are exploring ways to regenerate damaged kidneys using stem cells, and they're even developing bioengineered kidneys that could one day be transplanted into patients.
Wow, that's mind-blowing. I can't even imagine what it would be like to receive a brand new kidney grown in a lab. What about artificial kidneys? Are we getting closer to having, like, wearable devices that can do the job of our own kidneys?
Yes, there's a lot of progress being made in developing wearable artificial kidneys that could provide continuous dialysis, which would be a game changer for people with end-stage kidney disease.
Wow.
Imagine not having to go to a dialysis center several times a week.
Right.
It would be life-changing.
It'd be incredible.
Yeah.
It sounds like the future of kidney care is incredibly promising.
It really is.
But even with all these amazing technological advancements, I'm guessing prevention is still the best medicine.
Absolutely. Early detection and intervention are still the most effective ways to protect your kidneys and avoid more invasive treatments down the road.
So, knowing my numbers, those key lab values that we've been talking about, understanding my risk factors, and working closely with my doctor are still the best strategies for keeping my kidneys healthy.
You got it. Knowledge is power when it comes to your health.
Yeah.
And that's especially true for your kidneys.
Well, I feel like I've gained a PhD in kidney health thanks to this deep dive.
I'm glad to hear that.
Any final words of wisdom you'd like to share with our listeners before we wrap up?
Just this. Never take your kidneys for granted.
Okay.
They work tirelessly behind the scenes to keep your body balanced and functioning properly.
Yes, they do.
Treat them well by staying hydrated, making healthy choices, and being proactive about your health.
Those are words to live by. A huge thank you to you, our resident kidney expert, for guiding us through this incredible journey into the world of renal function.
It's been my pleasure.
And to all of you listening, thanks for joining us for this deep dive. Until next time, stay curious and keep those kidneys happy.